Hi, I'm Terry, and this is Ruth, and she's consented and over 18 for us to do the assessment today of her lungs, thorax, heart, abdomen. So we're going to start with the thorax, and we're just going to inspect. And her clavicles are in the midline, sternum is midline, clavicles are symmetrical. Can you take a deep breath and in and blow it out? Okay, good. That's very good. And we're going to palpate and see if you have any lesions or abnormalities there. Do you have any problems there? Okay. I'm going to go in the back for a second at the 10th rib. I'm going to ask you to take a deep breath in and exhale. And both sides have expanded symmetrically there. I'm going to auscultate the front. Deep breath in and blow it out. Okay, just relax. Come behind here and inspect. And I don't see any abnormalities here. Her spine is in the midline. Her coloring is the same on the thorax as it is for the rest of her body. She's got kind of a permanent light tan color, what I wish most of us had, but I certainly don't have. And do you have any problems when I palpate here? I don't feel any lesions, masses. I'm going to ask you to say 99 to check for fremitus.
99, 99, 99, 99.
And I don't have any problems there. Okay. Going to percuss in 12 spots.
Oh, you're good at that.
And I did hear resonance. Now we're going to listen with the stethoscope. Deep breath in and out. Okay, I'm going to grab a pen. We're going to lift your shirt up and I'm going to measure your diaphragmatic excursion. You could lean forward for me. We expect this to be between 3 to 5 centimeters. What I'm doing is I'm percussing from dullness to resonance. Can't quite mark it because of our bra, so we're going to get back down this way. Deep breath in and blow it out again. And hers is 3. Very good. Okay. So now for her cardiac. Oh, first of all, I want to tell you that when I listened to her lungs, I didn't hear any rales or rhonchi or any adventitious sounds. So for cardiac, I'm going to take a look at her neck and see if there's any JBD. I see the carotids pulsating, but there's no JBD present. I'm looking for heaves or thrusts, and I don't see anything there. I'm going to palpate for her point of maximum impulse, and that is the 5th intercostal space mid-clavicular line, right there, and that's readily palpable. And so I'm going to auscultate for her cardiac sounds, and it's going to be the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And the aortic is at the 2nd intercostal space, right sternal border, pulmonic, 2nd intercostal space, left sternal border. Erb's point would be the 3rd intercostal space, left sternal border. Tricuspid, 4th intercostal space, left sternal border. And the mitral will be the 5th intercostal space, mid-clavicular line. I'm going to be listening with both the belt and the diaphragm. And I don't hear any murmurs there, or any abnormal sounds. I hear S1 and S2, but I don't hear any S3 or S4. We're going to check her pulses now, so we're going to palpate temporal pulses, carotid pulses one at a time, brachial pulses, and compare both sides, and they are +2 throughout. Everything's going to be done bilaterally. Radial pulses, we're going to defer the femoral pulses, the popliteal pulses. Okay, you can relax your legs. We're going to check dorsalis pedis, posterior tibial, and there's no signs of edema either. I'm going to ask her to go ahead and lay down. We'll take a look at the abdomen. I'm just going to look through the video to make sure that you can still see that she's laying down there, and we're going to be checking her abdomen, all 4 quadrants. Inspection first. Her abdomen is flat. There's no striae. There's no discoloration. There's no Cullen sign. I'm just watching to see if there's any sign of abnormality as far as elevation or lesions before I touch. So we're going to inspect first. We're going to auscultate. In 3 places in all 4 quadrants. I'm going to listen for her renal arteries. Listen for bruit, aorta, iliac. I'm going to defer the femoral. I'm going to do some light palpation of the abdomen after I percuss. I'm listening for tympany. Do you hear that? I'm going to percuss over the liver, and it's dull. I'm going to listen for friction rubs over the spleen and the liver, or any bruits. And none are heard. Okay. Do light palpation. Do you have any tenderness?
No.
And deeper palpation. No masses, elevations, tumors, nothing like that is felt. Okay, we're going to try and palpate the spleen just gently there. Are you having any pain there?
No.
And I'm not feeling her spleen. And on the liver, we can palpate here. I'm going to use the hook technique. Can you take a deep breath in and exhale? And I don't feel it there. I think she's ticklish, just a little bit. Okay, I'm going to reach across and try to palpate the kidney. Deep breath in and blow it out. And I don't feel it there. And the right kidney, deep breath in and blow out. I think I might feel just a little bit on the right. The right is more easily palpable than the left if you are going to feel it. You would not expect the spleen to be out of the rib cage area below the costovertebral angle. And the liver, we're going to measure, see if we can see the size of that. Okay, and I would mark with a pen. There it is. I'm looking for the dullness there. Okay. Sorry. And you would expect that to be 5 to 10 centimeters. And hers is just about 4.5, so it's not very big at all. Okay. I think I got all of that. All right, so I think we're done.
Yay.